Thank you, everybody. Just in a previous life, I did work in Our Lady of Lourdes Hospital, and I was part of a working group for the rollout of the tobacco-free campus there. So I just wanted to talk you through maybe the steps that were taken from an operational perspective on how we rolled it out there. So first of all, the whole process started off with getting approval from our senior management team, and I feel it's essential at that stage, and it was essential to the success of the whole project, that we got buy-in from management at that particular time as well. It was very important. We formed our working group, and we just got representation from different departments. We made sure that we had all departments represented, and we agreed our timelines then, and we had a run-in period of about 11 to 12 months from the inaugural meeting to the actual rollout. And then we just got started then. So our priorities, the first one being an obvious one, being have a clean environment. Improving our image. As you know, Our Lady of Lourdes Hospital has always been in, has had bad media coverage, negative news stories. So it was an opportunity for Louthmead Hospital Services to have a positive news story. Also investing in health. We wanted to show as well that smoking is a true addiction, and that tobacco use should be treated as a care issue and not to treat the illness but to treat the cause. Okay, so around our planning and communications piece, by preparing the groundwork, we got our working group together. We got a representation from each department, and we used a communication toolkit as well. We tapped into the resource of the HSE Communications Department, and we had the expertise available to us on our committee as well, which was very important. We created our own branding because we were one of the first to roll it out, apart from St Vincent's and Cork University as well. Our Lady of Lourdes Hospital would have been one of the first to roll it out in the northeast. And we had to create, there wasn't a HSE resource toolkit at the time available to us, so we had to create our own leaflets, communications, posters and flyers, so that was a huge learning curve for us as well. We also had to arrange public engagement as well, and that was like, how are we going to engage with the public and let them know that this was happening in Drogheda, and also being media conscious at the same time and using them in a positive way, and getting the communication out there regularly, so that they, with updates, so that they knew what we were doing. And also about being creative, just to get people talking and to keep the subject current as well. So by preparing the groundwork, we had to bring the right people together, and as I said earlier on, the buy-in of our management was very important at that stage, and it was led out by our operational services manager. Our members of the working group, we had a cardiologist, again, very important to have medical leadership in, and we were able to wheel our cardiologist out for all our media interactions. We got him trained, and we had him for interviews, etc. We had a smoking cessation nurse, health promotion staff, operational services, librarian, catering staff. So we had a mixture of all our staff, and they were made up of smokers and non-smokers, so we had that balance as well. The union reps were invited but did not attend. So with regards to using a toolkit, from the outset we had a communications toolkit, and we agreed to terms of reference, and we basically stuck with those. As I said, we had an 11 to 12 month run-in period from the inaugural meeting to the actual rollout, and it gave us enough time to prepare. And we also have a quality improvement plan in place as well, and that's still in use as well. Regular meetings, monthly meetings to start off with, and then coming near the rollout, we'd fortnightly and then weekly meetings. With our branding and identity, we designed a logo. We had a countdown clock, and we had that in a very prominent position, and we were able to use a common theme. We kept a common theme in all our signage and our posters and our flyers. Just to get people talking, we had a lot of signage in our lifts. We had them in every floor, our entrances and exits, our staff areas, etc. So the public engagement and internal communication piece started with, we wrote out to the local residents, and we actually met with them as well shortly before the rollout, just to hear their concerns, which their main concerns would have been littering and loitering as well. So the letter went out to them. We also continued with our internal communication. We had a lot of broadcast emails on a weekly basis. We had our countdown clock. We had footnotes put into all our email correspondence. We had our franking machine, and we had a printer on our franking machine. We had that on all the letters that were going out. And then basically our external communication then consisted of engagement with public representatives, letters to our GPs, our pharmacies, just to let them know when the tobacco-free campus was being rolled out. And then our patient information leaflet was devised as well. That was left in all the GP surgeries, in all our outpatient, any public areas that we had in the hospital. And we had an accompanying letter as well for our outpatient appointments, telling them that we were going smoke-free as well. So, and we also, as I said before, we tapped into the HSE communications department, that resource, very important, and we engaged professional media assistants. As I said, the communications officer was a member of our group, and they provided advice and communication on the style and the timing of all the communication pieces. Again, very important to get the media training for our group members and have a spokesperson, or, as was mentioned previously, a champion, which was our cardiologist. They provided guidance on our press releases, very important, and we had also helped with our frequently asked questions from staff and from service users. And they assisted then with the launch of the tobacco-free policy on the day of the launch as well. So we just, with creativity, I suppose we had to maximise the power of the logo that we had, and we couldn't miss an opportunity. As I said, we had footnotes. At every opportunity, at the time we were printing out wage slips. We would have had company letters and leaflets for staff. We had a countdown, and that countdown clock was updated obviously every day, so it was in everybody's minds. And then the build up to the actual launch, then we had a lot of promotions on the week of the launch, and we were able to secure sponsorship as well for t-shirts and other posters and interactive promotional material as well, and then the day of the launch. We invited the minister again. That showed the great support that we had, that we meant business, and this was actually happening. And there's the former Minister Riley with our CEO, Margaret Swords. That's just some images from the launch. Again, we had t-shirts printed, and the Minister said a few words as well. So 2 years on, important really, I suppose the point is, it just doesn't stop at the rollout of the tobacco-free campus. The work is ongoing, and the working group have remained in situ, and the focus is on brief intervention training and trying to up the numbers for that. I suppose the challenges to that is the release of staff. Very hard to get staff released for training, but maybe they're looking at now maybe online training, providing that. So. Also maintaining the tobacco-free campus policy and supporting patients and staff who wish to quit. So it's an ongoing process, continuous review. So positive findings from a staff audit that was carried out in March of this year. It just showed from the tobacco-free campus, or the tobacco control policy, the smoking prevalence amongst staff had reduced by 3%, so that was a very positive finding. So going for gold, Miriam had mentioned earlier about the role of the European Network of Smoke-Free Hospitals, and in March of last year, Our Lady of Lourdes Hospital received gold membership of the European Network. And it recognised their high level of implementation, of a comprehensive tobacco control policy. It's the highest achievable international award, and Our Lady of Lourdes Hospital were the only health service in Ireland at the time to get that. I suppose what it means to them is basically it gives them membership for 4 years on an international forum, and they can swap ideas, and they can actually share and exchange best practice and provide support and advice and expert assistance to other healthcare services that have implemented the policy. Prior to going forward, the hospital had to go through a rigorous application process where a national jury visited the hospital, and the hospital had to demonstrate evidence of high performance of the implementations of the standards that Miriam had explained earlier. Also then, following that, the national jury process, an international jury then scrutinised their application, and they awarded the gold membership to the hospital. So that was a major positive achievement, you know, and it just goes to show that it was from the ongoing work, that it just doesn't stop at the actual rollout date. We got great support from the European Network of Smoke-Free Hospitals coordinator Miriam, and hard work of the staff as well to achieve that. So I suppose, as I said, I keep reiterating that the work doesn't stop. It's hard work living up to the Gold Forum status, and I suppose the challenges with regards to the Gold status would be the rollout of training, and maybe thinking of innovative ways of maybe rolling out training to staff that maybe mightn't be I suppose in contact clinically, non-clinical contact with staff, for the likes of our chaplains or healthcare assistants or portering staff as well. And also resources have been set aside to our postnatal, or not our postnatal, our antenatal services to provide smoking cessation for that department as well. So the challenges, as I said, would be in the training, but the key, I suppose, to the success, and it has been a successful project for Our Lady of Lourdes, is complete teamwork and management buy-in. So it's a very positive experience, and it is doable. So parting words is just do it. So short and sweet. Okay, thank you.